there's a lot of like CYA that goes on here. And now in this country, we're going through the same thing. Here's Donald Trump, the woman behind Donald Trump, as he's talking about it. She is, what is her position exactly? She's like the chief, oh gosh, what number clip is this? Oh yeah, okay. Yeah, this is this is Dr. Ann Schuchat, and she is one of the key players in sort of the response to the coronavirus. And we should make it clear that, she's the deputy director of the CDC. And watch her face as Donald Trump refers to how, like, this is not a big deal. It's like a common cold.
Any of their behaviors?
No, I think you have to always, I do it a lot anyway, as you probably heard. Wash your hands, stay clean. You don't have to necessarily grab every handrail unless you have to. You do certain things that you do when you have the flu. I mean, view this the same as the flu. When somebody sneezes, I try and bail out as much as possible with the sneezing. I had a man come up to me a week ago. I hadn't seen him in a long time, and I said, "How you doing?" He said, "Fine, fine." He hugs me, kisses. I said, "Are you well?" He says, "No." He said, "I have the worst fever and the worst flu." And he's hugging and kissing me. So I said, "Excuse me." I went there, I started washing my hands. So you have to do that.
Watch your face.
I really think, doctor, you want to treat this like you treat the flu, right?
I mean, a bit, but
it's going to be.
No, yeah. Now you can't see it.
I love that.
This footage is a little bit broken up, but the look on her face is like, no. But yeah. She can't get up and say that. And they have a concerted effort. Mike Pence's czarism on this is not, I'm going to coordinate all of the different efforts. It's, I'm in charge of making sure no one says anything that will reveal what's really going on. That seems like a problem, Kate, as a chief epidemiologist at various New York hospitals.
Yeah, I mean, it's certainly, I would say that my official medical opinion is that it's not good, especially in a country where we don't necessarily have healthcare available to every person. It seems like it could go wrong, but, what do I know? Well,
I mean, so much of this is about, we now have a whistleblower who's going out. Remember the chain of events here. The CDC, there were people coming from on a flight, coming off of a cruise liner that people were afraid had been infected.
Yeah.
The CDC did not want to fly them back commercially.
This was a Scientology cruise. Is that a detail that was correct?
Is that right?
I think it was.
A Scientology cruise?
I think it was a Scientology.
Is that
oh my
right?
God.
I can try to look that up. But
I'm not
They
sure.
do believe in physical ailments, right?
Well,
yeah.
I mean, sometimes with these cruise ships, people will have like conventions on like the cruise ship itself, but it not be like a Scientology cruise. Like they'll just have like a convention on like a particular cruise ship. Like they'll have like 150 people on.
Oh, yeah.
Who knows?
Like
Either way, it's
I went on a Rock and Roll cruise like that. It was like 100 punks and a bunch of normies on a Carnival cruise ship.
Yeah, I mean, that's largely irrelevant. The bottom line, though, is that you have these Americans. They're being repatriated. The CDC said, we shouldn't do this. We shouldn't do this. And the Trump administration overruled them because they didn't want anybody to think like it was a big deal. It's like the Trump story. The guy had a fever. He came in and hugged me. And I'm like, come on, guy. And then because they don't want to alarm anybody, Health and Human Services sent federal workers to go and deal with these people coming off and did not equip them in any way properly, brought them to an air base, I guess. And this guy in California who has it, they're only suspecting because of the federal regulations that basically narrowed who should be tested for this. Federal regulations that were just propagated by the CDC being stepped on by the Trump administration. They can't quite figure out where it is, but they think it may have something to do with these workers. And a whistleblower has now come out and said that they had no monitoring, no testing regime in place. And it is the first U.S. contracted, not coming from overseas, but contracted within the U.S., comes from that general vicinity. And people are starting to speculate that it's a function of that. And then apparently... when someone at the Health and Human Services talks about it, they're criticized for hurting morale and then ordered to another position or to be fired by the administration. That seems to be, you're playing with fire.
Definitely seems that way. It seems like also that this could end up, like you were saying earlier, I definitely think that they could possibly start alienating even people who have gone with them on some of the other corruption stuff, like people who absolutely don't care about anything related to Ukraine or, Russia. I think could potentially be like, okay, well, I don't want my kid to get this virus. It might start leaking into people who voted for him actually.
I think that's true too, and the stock market has, look, I think the stock market is completely overrated in terms of an economic measure, and it is helping a fairly narrow subset of Americans, but they are highly sensitive to it, and as it drops, I think it starts to shake some of his support, even from the wealthy folks.
I mean, the stock market as a measurement of the faith that a particular part of the population has in the functioning of the country and of the world. It's good for that, unless you don't try to extrapolate.
Right.
But I mean, look, I'm not an epidemiologist like Kate, although I do have a master's in body language analysis.
A body language expert. Nice.
Ladies. But here's what I will say about the coronavirus, just apart from the points already made. I think as epidemic, it has the ability to lay bare just how many gaps we have in our society at various levels and various points, and not just the ineptitude of the Trump administration, but like Katie said, it's we live in a country where millions of people don't have health insurance. And not only do millions of people don't have health insurance or access to health care, even more people are health care precarious in a way that might lead them to, roll the dice if they have the symptoms. We have a culture of people who are just afraid to go to the doctor, who have an instinctual fear of going to the doctor because, hey, you know what if I go to emergency room, my insurance company will only cover if I'm admitted, and so I go, and what happens, if I'm not sick, I'd rather just wait until it gets too bad, right? And so that's one aspect of it. And the second aspect, we have a culture of people, no paid time off. A lot of people don't have sick days. A lot of people can't take, for a lot of people, they take off to go to the doctor, they get coronavirus, that's their paycheck, that's their rent money. And so you're weighing health versus going to the doctor. And just another point that people have been making.
Right. I got news for you. Enjoy your salad at your next restaurant meal.
Yeah.
Worked by someone who doesn't have time off.
I mean, exactly. The CDC did a study a few years ago. It came out that they polled restaurant workers, and I'm sure you remember this, Sam, because I might have heard it on your show. And they found out that 15% of restaurant workers come into work despite the fact that they are sick with some kind of stomach contagion.
Yep.
that leads to vomiting or diarrhea. So they come to work and they handle food and they do that's how salmonella spreads, and it'd be how the coronavirus spread. So there are so many little aspects of our society that are obviously always deleterious and hurt people on an individual level, and they are able to be abstracted, or rather made into a discrete problem for individuals, because we have a hard time conceptualizing something as social health. And so when you put an epidemic into the mix, people have a much easier time. It's oh yeah, all of these things that people struggle with all the time do not exist in vacuums. They're actually related to our society in sort of in a given flow way. And I would even say something that people are advising, or rather making the connection with, Medicare for all would have done a lot to abate this health crisis.
Yes.
But and so obviously coronavirus is a public health crisis, but I would say it's a step further. It's the lack of Medicare for all, the fact that we have so many people without access to healthcare, without access to medication, by itself was a public health crisis. And now that we have the influx of a pandemic or epidemic, I don't know the difference right now off the top of my head, but I used to. It's that public health crisis is becoming visible to what it actually is, which is
right.
Yeah, and the virus doesn't discriminate between who's poor and who's rich.
It's the great equalizer.
I mean, Bernie's always saying we're all in this together. Maybe that will help hammer the point home for some people. I saw a news story today about a guy who thought he had the coronavirus. He'd been to China. He got tested for it. And then he gets a bill for thousands of dollars. Then I saw Nancy Pelosi saying, oh, the vaccine should be affordable. People should have affordable access to it. Like, what the hell are you talking about?
Right.
Yeah.
Just give it to people.
Yeah, I mean, I am a comedian, and so most of my friends who are also comedians do not have any health insurance. And, if we need to go to the doctor, we just end up like paying cash. And, most of my friends...
You pay in jokes?
Yeah, but I mean, like, honestly, most of the time, like, we end up trying to just cure stuff with like, spells and herbs and stuff like that. And I feel like a lot of people are living like that, and that is fine with the ruling class in this country most of the time. But it is going to be this thing where, like, at restaurants, the people who are serving your food may not have access to healthcare, and you may just like actually start to see people who normally don't care at all about the fact that a lot of working class people in this country don't have health care. Like, it's going to start to affect their lives in a real way, potentially.
Yeah,
Will
it's so illustrative.
Will doctors take a like a coupon for a free drink at Eastville or something like that?
Yeah, totally. Yeah. Just like, can I pay you in all these drink tickets I've compiled?
This is again, the stock market has a lot of resonance with a small number of people, but these are the people on the vanguard of the sort of the Trump support of people who I think are, these are single issue voters on some level, and it's like, what's my stocks doing? And this is, Donald Trump has throughout his presidency talked about the stock market probably more consistently than anything else.
Yeah.
And they're on the is this Fox News? CNBC. And you can hear in the background, like, apparently someone is just yelling about what's going on there. I don't know if they actually do this on the floor of the stock market, but watch this.
You'll look for stocks with good dividends and things like that.
Any stimulative effect, if any, that could come out of these low interest rates. Stephanie was saying she was shopping for housing stocks, for instance. How do you look at it?
So, but basically what's happening, I think, is that the reporter from the floor is speaking up to the studio, and they're picking up someone, like some broker just going into a hallway, just going like, I can't fucking believe it, on my shirt. And they're picking it up on that. I think is I think that's a problem for Donald
Yeah,
Trump.
I mean, that's his main argument for his own reelection, is that the stock market was doing well and the economy is doing well, and if that changes, like, people are just like, oh, this guy is pretty corrupt,
I mean, I think you both are making great points, and I think the danger there too is him trying to craft a narrative that empowers his far right campaign in a way that spins like, he might lose some stockbrokers because the market's going to crash, but him trying to find a way to turn this into like an argument against immigration, an argument against I've mentioned it prior to Dave Weigel coming on, but we already have camps in place. They already floated the idea of putting homeless people there, and we've already seen that in the case of extreme public distress, people are willing to hand over some civil rights or look past certain things. So I think there is a slight danger that this is used.
They're definitely going to try.
Yeah.
They're definitely going to try. But the problem I think they're going to have with that is when it's clearly not a function of, like, the coronavirus is not coming. Like, it's Italy that shut down. We do not share a border with Italy. The vast, overwhelming number of immigrants that come, or visitors that come to this country from Italy, do not go via Mexico. That just doesn't happen. And I think that's something they can sell to their, like, the core.
Yeah.
There's no doubt about it. But from the perspective of, like, again, suburban voters who are, to the extent that there are any swing voters in this, or to the extent that there are any voters who are going to come out and make it a referendum on Trump, and maybe the existence of like a Bernie on the ticket might be, make it more of a decision. I think that's not going to work with them in the same way. Plus, the reality is, and I don't know from a political perspective if this has any salience. The reality is that like our immigration policy in this country, scaring immigrants to the extent that we have undocumented, is the worst case scenario you have when you're dealing with a pandemic.
Exactly.
Because these people, the last thing they're going to do. I mean, you talk about like lack of health insurance being a reason why you don't go in. The idea that I could endanger my entire family and I could get kicked out of the country because I'm sick, I'm not going in. Like literally, if this thing is as contagious as it sounds, we may have to see like underground clinics that are set up to service folks who are afraid of going into the hospital and getting, because it would not be absurd for them to think like, I'm going to be on some type of registry and I don't want to do that. I mean, I can't be quarantined.
I mean, they're right. I mean, honestly, and I think that goes back to my point. It's an important point that you're making. It's like the infrastructure that would lead this pandemic to be uncontrollable is already there, or the lack of infrastructure. Like ICE already does things like that. So like anyone who pretends as though somebody not going to the hospital because they believe they have corona symptoms who is undocumented is behaving irrationally is wrong. It's like, because there's a 100% chance that ICE will come, not 100%. There's a very good chance that ICE will come in and to the hospital and you will be removed and deported back to Mexico. And they're right now they're also trying to denaturalize people at the same time. And so like escalating this is only going to cause more people to go underground and more people who might have symptoms to continue to like try to avoid being on various like lists or documented at hospitals. And so we already have all of the missing pieces in place in our society to make something like this go rampant. And now we have to actually sit down and question like how we got so far down the line where it's very possible that a pandemic could just ravage America, and because we just don't have the infrastructure in place to deal with it.
Right. And we should be clear, like, I don't want people to panic too much. The death rate for this at this point, to the extent that we understand, is close to about 3.5%. Now, again, the numbers out of China are, certainly people are starting to question whether we actually know the real numbers. But it is extremely contagious. And really what is more likely that we're going to see is not just like people in the suburbs worried about their kids in going to school, but it's also going to be like Facebook just canceled their coders meeting in Santa Cruz, and Microsoft's not sending people to the gaming convention. And it's like, it's not irrational to entertain the notion that like, we may not have political conventions this year. I mean, it's not, I don't think we're there. And I think it's a big leap to say that that's going to be the case. But it is not irrational to entertain that notion that big parts of Italy apparently are shutting down. This is, my daughter texted me today because my daughter's whole, she's got a cottage industry of taking the clothes that I buy her and then selling them online to Depop. And I don't know what that is. And then she sometimes uses the money she gets to buy stuff. And she texted me today and she goes, I got a notice from Depop. Clothes I ordered on February 1st are not going to come. They don't know when it's coming because of coronavirus in China. I'm terrified. What am I going to do? And I'm like, well, they're not going to send you coronavirus in the mail. It's just like, but we're going to start to see more and more of this. There's already apparently one now official shortage of a drug that has been announced by the CDC as of today. I don't know what the drug is because it's all being made in China. All right. Well, before I want to take a break here and we'll go into the fun half. And when we come back, I want to talk about what the brain trust of the Republican Party, Rush Limbaugh, has instructed all of them to do. And they seem to be trying to do it, but it's hard. It's a hard thing for them to do.